Hello, Data Bees, and thank you for joining us. Today, we're here with Kaushik Bhaumik, new CEO and co-founder to join Glide Health, the Hive startup that's revolutionizing the healthcare industry by driving smart revenue growth for providers, plus financial personalization and affordability of care for patients. Kaushik joins Glide Health after spending 16 years at Cognizant, where he led their $3.2 billion healthcare business, including one of the largest U.S. clearinghouses. Prior to Cognizant, he was a consultant for McKinsey. Hi, Kaushik. Thank you so much for joining us virtually today.
Absolutely, Maddie. Good to be with you.
Great to have you here. So, Kaushik, can you please tell us more about your journey through the fast-changing healthcare industry over the past 10 years?
Sure, happy to. I've been very fortunate to have a front row seat to the healthcare industry for almost the last 20 years. In my career at Cognizant, early on, I worked with a lot of the large U.S. health insurers and providers, moved to a global delivery model for some of their key functions, whether that's claims, provider credentialing, appeals, and grievances. And so that gave me some very deep insights into how they operate, what worked well, where were the inefficiencies. Towards my latter part of my career at Cognizant, when I directly ran the healthcare business, we did a very large acquisition of one of the largest healthcare payer systems, claim systems, TriZetto. And so we ran that system, which processes 1 out of every 2 claims in America, as well as one of the largest clearinghouses that moved claims from doctors to the insurers. So I've seen a lot of important changes occur in the industry, which has been great. Historically, the industry spends somewhere to approximately 15% of the overall industry, which is $3.5 trillion, on administrative services and technology, which is a lot of money, but it used to actually be higher. It was closer to 20%.
Oh, wow.
But we think that's going to needs to come down even more. And so with some of the newer technologies that are out there now, such as artificial intelligence, we think there's an opportunity to lower costs even further and improve the experience for the patient as we move forward.
Wow. So you definitely have a very interesting and long history in the healthcare sector for sure. So speaking to that, how do you see the healthcare industry evolving over this next decade? And what specifically is that going to mean for our communities and for the patient experience, kind of like what you were just talking about?
Sure. I think, the industry is finally putting the patient in the center of the experience. If you look at all other facets of our life, it has gotten so much easier to do things, whether it's shop, to interact with your friends and family and so forth, with all the technologies and tools through the mobile phones and the internet and so forth. The healthcare experience, however, is not there. It's still very paper-based. The technologies and the systems don't talk to each other very well. Very often you'll find your insurer doesn't know what your doctor's doing and vice versa. It's very hard to figure out what's covered, what's not. And I think what we're going to see over the next several years is finally those problems being addressed for the patient to make things smoother. People want to have an Amazon and Google-like experience for their medical experiences as well. So whether that's the ability to track your exercise and your diet, to be able to have your health records on your phone so you don't have to call it in and things along those lines, to be able to monitor your progress on your health, to be able to address claims and billing, all that simply and easily through your phone and laptop. That's what the industry is moving toward. And I think the good news is there are a lot of folks and the industry more broadly is trying to address these problems and make it a lot smoother. And if we're able to do that, one of the side benefits will be the costs will come down, that we'll be able to take a lot of inefficiencies out of the system, a lot of the paper that still goes back and forth, all that back office processing can really get a lot smoother, take that cost out, and that then helps lower costs for everybody in the industry. Because despite U.S. healthcare being great, it is still the most costly healthcare system in the world, and it doesn't need to be if we could take out some of these inefficiencies.
Wow, I love that experience that you're describing, and anything that's going to help make it more efficient and save money for the patient, and make it more efficient for the providers. That's awesome. So, how does this influence vision that you just described How does this influence you to jump into your leadership role at Glide Health?
Sure. Most of my career, I worked with very large organizations and companies and helping them utilize technology to make things better. And I enjoyed that. It was good to have that experience and help shape some very large changes at some big companies. But at this point in my career, I first of all wanted to get that startup experience. Being here in Silicon Valley for over 20 years, you're surrounded by it. And so I felt the time was right for me to do so. I wanted to do it in healthcare and in an industry I enjoy. And I wanted to pick a problem in healthcare that I felt was ripe for disruption. And one of those problem areas is this whole notion area called revenue cycle management, the whole area of helping doctors get paid by their insurers accurately and quickly. It's very time consuming. It chews up a lot of cycles for physicians and hospitals, and there's a lot of wastage and denials there. So I felt if we could apply technology towards that problem, there will be a lot of benefits associated with that, not only for the people, the doctors and the insurers, but namely also for the patients. And so I saw that in Glide. I saw the problem that they were tackling. I saw their innovative use and application of artificial intelligence to address that. And I said, gosh, I want to really be a part of that.
Wow, that's so cool to hear because it sounds like, to what you're speaking about, even just by saving time for those doctors with the denials that you're describing, that means that they can take that time and instead focus on patient care. So that's really, really meaningful stuff that you're doing. And I'm so excited to see you with Glide. So, we're in interesting times right now, Kaushik. As you know, we're doing this
Mhm.
virtually instead of in person, and that's because of COVID-19. How do you see the current COVID-19 pandemic situation influencing the future of Glide Health?
Sure. So one of the silver linings in the COVID situation, which is obviously a very difficult societal problem that we're dealing with, one of the silver linings, it's forced a lot of change in the healthcare system in a very short amount of time. So some of the trends that were underway in healthcare that were positive was this whole notion of telemedicine, being able to
Right.
interact with your doctor remotely, not having to go into the office and so forth. Similarly, with being able to get your drugs shipped to your home and so forth, not having to go into the pharmacy and those types of, those were trends that were already in play, but they were happening slowly, and their adoption was relatively slow because of COVID and the fact that basically we really shouldn't be interacting so much to reduce the spread of COVID. That has forced a massive these changes to go into hyperdrive
Right.
so that people now are much more comfortable doing a consultation with their doctor, just like you and I are holding this interview. Similarly, to have their drugs fulfilled and delivered to their homes, just like Amazon would, instead of having to go into the pharmacy. So as a result of that, the digitization of the healthcare experience has really amplified and taken off, which I think is a very positive thing, because that's going to allow for smoother interactions, help reduce the cost of care, because you don't have to have as many offices and things like that to deal with patients. Now, as it relates to Glide, that digitization experience has also need to go towards that patient reimbursement, right? The provider reimbursement. That is, when the provider is interacting with their patient, prescribing drugs, doing examinations, and so forth, they too want to have electronic fulfillment of their fees and equipment expenses and drug expenses, and not have to go through a very laborious process that exists right now. So with the artificial intelligence technology we've developed at Glide, we're able to help these doctors and providers predict which one of their claims are going to run into trouble. That is, there's not enough documentation, or it's controversial in terms of the therapy that's prescribed, and so on and so forth. Be able to help them identify that up front so that they provide the right documentation, the right justification, and so they could submit it electronically, and there won't be any bounce back of that. And that those denials, as they're often referred to, claims, is a huge pain point for doctors. They encounter there's over $300 billion worth of denials in the U.S. healthcare system every year. So that's a lot of money that doctors are not getting for their services because of errors, insufficient information, et cetera, et cetera. So we feel that same digital technology around AI can really help address that problem.
Right. And even, to your point earlier, I mean, as you make that automated, you're allowing and freeing up that time instead of doctors chasing down for these denials
Correct.
to be with
Correct. Right.
their patients. So
Right.
that's fantastic. And I'm so glad that there's some silver lining to this
It
pandemic,
is.
at
Yeah.
least for some people. So, Kaushik, if you, let's say, had a crystal ball, and you could see 5 years into the future, which, keep in mind with how times have been lately, and nothing is for certain, of course.
Mhm.
But if you could see 5 years into the future, how would Glide Health be changing our healthcare experience? Like, what would you envision? What do you see?
Yeah, I think if we're successful with our mission of applying AI and helping the providers have a more level playing field with the insurers, because right now, if you were to look at the industry, you would say the insurers have most of the power and control how the business operates very much. It would be much fairer if the providers can get paid upfront more accurately and more quickly, and that frees up their time for less administrative expenses and costs and more time for patients. So I think if we're successful, 5 years from now, we'll come back and we'll be able to describe a situation where the providers now are spending less time and money on doing all this administrative stuff, more time with their patients, and the overall industry is actually more efficient because we've taken out a lot of this administrative cost. Right now, that administrative cost is about 15% of the total economy, which is of the healthcare economy. It'd be great to drive that down to 10% or less, and that helps lower the cost of healthcare for everybody.
Right, right. So everyone wins. That's awesome. And I know that you have just joined the Hive ecosystem and under very interesting circumstances, no less.
Yeah.
Um, but can you say anything in particular about your experience working with the Hive?
Yeah, what really attracted me is, it reminded me a little bit of grad school at Cornell when I was pursuing my PhD there. It's a great assembly of very talented individuals who are working on some very tough problems. They're all coming to the table with answers and solutions and so forth, and all in the spirit of trying to build a very thriving and successful business ultimately. And so to me, that had a lot of similarities with grad school, when we were all taking tough problems. Now, in grad school, we weren't as concerned with building a business per se. So maybe that's where the difference ends, but everything else is very similar. And so, and that period of my life was a very, happy period in my life. And so it reminds me a lot of that. And it's fun to kind of relive that in this new kind of environment.
Oh, we love hearing that. Thank you for sharing that personal story. That's awesome. We're getting to the end of our time here, but before we wrap up, can you just tell us maybe anything else you'd like anyone to know about you or what makes you tick?
Sure. I've always been a goal-driven individual. I always like to set personal goals for myself, whether that's, both professionally and on a personal level, and try to achieve those. And that kind of helps set my pace for myself and gives me focus on, what I want to do every day and, for a period of time and so forth. And I felt that the Glide opportunity was exactly that, what I needed. I had a very successful career for 25 years in the large industry professional sector, but I'd always wanted to do a startup. And being here in Silicon Valley and not doing a startup, I felt like I was missing out on something. Now I know startups are hard and they're very difficult, and a lot of them don't work out. But I'm up for that challenge, and so that's definitely something that motivates me. But also, I'm not just all about work either. I have a wife and two teenage kids, and I love to spend my time with them. And I take time personally to read, bike, golf. I love rock music, so that's how I sort of get some of my energy out. But that's what motivates me and keeps me going every day.
Oh, wow. Well, thank you so much for sharing that. Kaushik, it was so great to get to know you better. And thank you for your time. I know you're very busy changing the world of healthcare as we
Yeah.
speak. So we're so excited to see what you and Glide Health create in the future. And Database, thank you so much for tuning in and be well.